covers our buddhi? What covers? Slides move हो रहे ना?
No, sir.
No, sir.
तो दिस ओवर अभी दिख रहा है?
हाँ, आधी
Yes, this is Adi. Can you see this?
yes.
What is Adi? Adi is Avarnat Dhi iti Adi. So anything that covers our buddhi is called as Adi. Anything which covers our buddhi is called as Adi. Now Adhije Vyadhi. The Vyadhi due to Adi is Adhije Vyadhi. What is Adi? Adi that covers our buddhi or our discrimination power. Okay. Now what covers our discrimination power? हमारा बुद्धि को क्या कवर करता है? जैसे कि फॉर एग्जाम्पल हम सब जानते हैं कि योग करना चाहिए, हम सब जानते हैं कि जंक फूड नहीं खाना चाहिए। जैसे कि फॉर एग्जांपल हम ले सकते हैं जो हमारे जो डायबिटीज के पेशेंट्स रहते हैं, सभी डायबिटीज के पेशेंट्स को पता है कि उनको स्वीट नहीं खाना चाहिए, उनको रेगुलर एक्सरसाइज करना चाहिए, उनको टाइम टू टाइम मेडिसिन लेना चाहिए, उनको अपने इमोशंस कंट्रोल में लाना चाहिए, टाइमलाइन मेंटेन करना चाहिए, ये सभी को पता है। लेकिन ओनली सम 1 to 2% पीपल ही उसको फॉलो करते हैं, बाकी सभी फॉलो नहीं करते। क्यों नहीं करते? ये सभी को पता है। Every diabetes patient know it, but not everybody can follow it. Now what is the barrier is their emotions. It is the barrier is their emotions. जैसे कि पार्टी में चले गए, मतलब ये अक्सर हमेशा डायबिटीज पेशेंट्स के साथ होता है। जैसे कोई पार्टी में चले जाते हैं, तो पार्टी में या कोई फंक्शन में चले जाते हैं तो बहुत सारे स्वीट्स वहां पे रहते हैं, तो जैसे ही स्वीट्स वो देखते हैं तो उनको बहुत क्रेविंग आता है। तो इट इज वेरी नेचुरल, डायबिटीज होने के बाद स्वीट के प्रति क्रेविंग बढ़ जाता है नेचुरली। तो स्वीट क्रेविंग बढ़ जाता है तो उनको स्वीट खाने का मन करता है। फिर वो जानते हैं कि मेरा शुगर लेवल ठीक नहीं है, मुझे स्वीट नहीं खाना चाहिए, घर में वाइफ जो है मना की है, तो थोड़ा कंट्रोल करते हैं। फिर थोड़े दिन के बाद थोड़ा खा के देखते हैं, थोड़ा खा लेते हैं, है ना, ऐसा बोल के वो स्वीट खाते हैं। नाउ क्या ऐसा चीज है जो उनको स्वीट खाने में मजबूर किया? ये उनका मन है। मन में भी क्या है? मन में भी स्ट्रॉन्ग लाइक और स्ट्रॉन्ग अट्रैक्शन टुवर्ड्स द स्वीट। अब हर डायबिटीज पेशेंट को पता है कि उनको रोज करेला खाना चाहिए। जब करेला ला के देते हैं तो 1-2 दिन खाते हैं, फिर तीसरे दिन नहीं खाते, बिकॉज दे हेट करेला। सो स्ट्रॉन्ग हेट और स्ट्रॉन्ग द्वेषा टुवर्ड्स करेला एंड स्ट्रॉन्ग रागा और स्ट्रॉन्ग लाइक टुवर्ड्स स्वीट इज द कॉज, है ना। तो ये जो राग और द्वेष हमारे मन में है, हमारे अनकंट्रोल्ड इमोशंस जो है, ये सब क्या करते हैं? ये सब हमारे बुद्धि को आवृत्त करते हैं। हमारे बुद्धि होते हुए भी हमको उसका यूज नहीं होता। We fail to utilize our discrimination power because our discrimination powers action is covered by our emotions. Now that is called as Adi, Avarnat Dhi. तो ये आदि कहाँ पे रहता है? आदि हमारे मनोमय कोश में ही रहता है। आदि हमारे मनोमय कोश में रहता है। मनोमय कोश में किस फॉर्म में रहता है? इन द फॉर्म ऑफ अनकंट्रोल्ड इमोशंस, fear, stresses, depression, excess worries, anger, jealous, hatredness, boredom, ये सभी जो है, जो षड रिपु बोला है ना, काम, क्रोध, मोह, मद, मात्सर्य, या जो राग, द्वेष, अभिनिवेश, ना, अविद्या, अस्मिता, ये सभी जो है ये आदि ही है. They all are adhis, and where they exist in the manomaya kosha. They exist in the manomaya kosha, and there are deep rooted conflicts. इसको हम बोलते हैं कि belief system है ना, wrong belief है ना, तो ये सभी जो है हमारे मनोमय कोश में रहते हैं. तो इन सभी के जो टोटलिटी है उसको हम बोलते हैं आदि. Is Adi. Adi is there in the Manomaya Kosha in the form of all negative emotions. Okay. Now, when this Adi is strong, when the strong Adi is strong, the Vijnanamaya Kosha becomes poor and poor. If your Adi is stronger, Vijnanamaya Kosha become poor. You have Buddhi, but it is of no use. Okay, so your buddhi will be suppressed by your adhis. Now based on this, there are two types of the disorders: adhija vyadhi and anadhija vyadhi. If your disease is caused by your uncontrolled emotions, then
slide change करना है.
नहीं, यही स्लाइड में बोल रहा हूँ.
Okay.
So if your disease is caused by uncontrolled emotions, then it is adhija vyadhi. Okay. So this vyadhi is divided into adhija and anadhija vyadhi. So adhija vyadhi is because of your manomaya kosha. Anadhija vyadhi is not because of your manomaya kosha. It is because of some external factors. External factors means accidents, infections, natural calamities, some bites, isn't it? So all these are anadhija vyadhis. Adhija vyadhis which originated in the mind. Okay. Now adhija vyadhis are again divided into two types: saraja and samanya. Saraja and Samanya. Samanyaja Adhija Vyadhis are all these disorders. Samanyaja Adhija Vyadhis are lifestyle born disorder. Okay. When we follow unhealthy lifestyle and that leads to diseases, such disorders are called as Samanyaja Adhija Vyadhis. तो जो भी हमारे डायबिटीज है, हाइपरटेंशन है, अस्थमा है, बैक पेन है, ये सब डिसऑर्डर्स जो कि हम नॉन कम्युनिकेबल डिसऑर्डर्स डिस्कस कर रहे हैं, जिसकी वजह से पूरा जो ह्यूमैनिटी है सफर कर रहा है, जो कि हमारा अभी का मेजर कंसर्न है, दैट इज नथिंग बट द सामान्यज आदिश व्याधि. ओके, सामान्यज आदिश व्याधि. Then Saraja Adisha Vyadhi is the disease which born right from the birth is Saraja Adisha Vyadhi. अब इसको भी हम मन से जोड़े हैं. So this is also because of the Adi. This is अभी तो मतलब now the birth has birth defects है ना, किसी को एक पैर Saraja Adisha Vyadhi. So you can see some birth defects. So एक ही बॉडी है और दो फेस है, यहाँ पे ऐसे मतलब अपाहिज थोड़ा जो पैदा होते हैं. So such disorders are called as Saraja Adisha Vyadhis. Now why Saraja Adisha Vyadhis? Because these disorders are because of the deep rooted sanskaras in the Manomaya Kosha. Now when we die, only the physical body and pranamaya kosha become separated. Otherwise, all other koshas remain same and they are transported to another birth. That's why in the next janma also you have similar kind of likings, dislikings, isn't it? So all those things will be there because manomaya kosha, same manomaya kosha or same sanskaras will be there in the next birth also. So you all are studying now yoga. That means you have already studied yoga in your previous life, because such sanskaras are there in your manomaya kosha this life also. That's why yoga is attracting you here. Okay? Like that. Now, Samanya Adija Vyadis are heart diseases, migraine, diabetes. So all disorders nowadays, whatever problem we are facing, they all are nothing but Samanya Adija Vyadis. Okay. Now, how to treat Samanya Adija Vyadis? By lifestyle modification. How to treat these disorders? By lifestyle modification, by yoga, by making our Vijnanamaya Kosha stronger. Anadija Vyadis are external diseases because of the external factors like infections, accidents, and so on. And such disorders are easily cured by medicine and surgery. Medicine and surgery. Now, yogic pathophysiology of non-communicable disorders. Okay. So, non-communicable disorders, how they take place? Pathophysiology means how a disease manifests because of certain reasons is called as pathophysiology. Now, Adi present in the Manomaya Kosha. So, Adi which is there in the Manomaya Kosha. Adi which is there in the Manomaya Kosha. Now, when there is Adi, when there is uncontrolled emotions, deep-rooted emotions, strong emotions, what happens? They bring a certain energy in the Manomaya Kosha. Certain energy in the form of certain speed. Okay. So there is speed in the Manomaya Kosha. You all have seen, basically, when we get angry. Okay. Now, what happens to your speed in the mind, whether it increases or decreases?
Increases.
Increases. When you are anxious, what happens to your speed in your mind? When you are increases. When there is anxiety, there is increase in the speed. In anxiety, patient complained that I cannot stop my thoughts. So such things. So what happens when there is Adi in the Manomaya Kosha? There is increased speed in the Manomaya Kosha. Now, when there is speed in the Manomaya Kosha, the speed in the Manomaya Kosha comes down to Pranamaya Kosha also. Comes down to Pranamaya Kosha also. Now, when it comes to Pranamaya Kosha, it increases the speed in the certain organs and it brings decrease in the speed in certain organs. Now, when there is an increase and decrease in the speed in the Pranamaya Kosha, that brings the increase in the speed in the Annamaya Kosha. Now, when it comes to Annamaya Kosha, first it affects the metabolism. Metabolism is our body functions, our body metabolic property, how we convert the food into energy is metabolism. Okay. So that function is affected. Now that function is affected in the form of ajirnatvam, kujirnatvam, atijirnatvam. Okay. Ajirnatvam means low metabolic activity. Now, ajirnatvam is not ajirna, indigestion, what we have in normally what we have ajirna or indigestion. It's not that. This ajirnatvam is low metabolic rate. For example, obesity. So obesity, what happens in the obesity? In obesity, person is unable to digest the protein, fat, or carbohydrates. So everything he starts storing it in the form of fat. Even the obese patients, they eat very little, but still they gain weight because whatever they are eating, they are not digesting it. Why they are not digesting it? Because their metabolic rate is very low. That is ajirnatva. For example, diabetes. Okay, so in the diabetes, there is lot of sugar. There is increased sugar level in the blood. Why there is increased sugar level in the blood? Because they are unable to utilize that sugar, which is ajirnatva. Then atijirnatva. Atijirnatva is hypermetabolic state. Hypermetabolic state. They are eating a lot, but nothing is forming the tissue. Everything is getting burnt immediately. For example, जैसे कि आपने देखा हो hyperthyroidism. Hyperthyroidism is thyroid function जब ज्यादा हो जाता है, तो कितना भी खाए वो weight loss ही होता है उनका. Is अतिजीर्णत्व. उसके अपोजिट हाइपोथायराइडिज्म. हाइपोथायराइडिज्म में कितना फास्टिंग करते हैं फिर भी उनका वेट गेन होता है. इज हाइपोथायराइडिज्म. देन कुजीर्णत्व मीन्स abnormal metabolism. You are eating something, your body is producing toxins, okay, which is kujirinatu. For example, autoimmune disorders. For example, rheumatoid arthritis. So your body is accumulating abnormal toxic materials in your joints. Okay, so kujirinatu. So when there is adi, which is there in the form of speed, comes into your pranamaya kosha and brings the speed in the pranamaya kosha, and that speed in the pranamaya kosha affect your metabolism, and once the metabolism is affected, that leads to chronic disease. Now when there is increase in the adi, the speed in the manomaya kosha, that brings increase in the prana, the increase in the speed in the prana. For example, if it is a vyana prana, which is there in the heart, which is responsible for circulation, if the vyana prana is increased, or speed of the vyana prana is increased, then there is hypertension. If the speed affects the samana prana, that causes gastritis or that causes diabetes. If it affects the apana prana, that causes IBS or that causes constipation. Okay. So similarly, which prana get affected